Reddit with Shelter. That's the name you gotta remember. I hope you enjoy this video. Like, subscribe, it's Reddit with Shelter.
Gynecologist of Reddit. What is the worst thing you've ever seen? Deleted. Actual gynecologist here. Tampons left in the vagina for days/weeks are always pretty unpleasant. As a necrotizing vulva, those don't hold a candle to the worst thing I've seen/smelled. I saw a 19-year-old girl who came into clinic and told me she had the cap to a bottle of hairspray stuck in her vagina. Okay, sounds easy enough to take care of. Thing is, she had put it in there when she was 15. 4 years prior. Would not disclose why, but was obviously very embarrassed. You could smell something horrible even before she undressed for an exam, and it was much worse once I actually got in there. The cap was in there with the edge up, and her vaginal tissues had been growing around it for 4 years. She required extensive surgery to get it out, and it had perforated, made holes into her bladder and rectum that also had to be repaired. Thank you for being a real gynecologist. Also, my condolences. I have many stories from working in the emergency department. The first story was undifferentiated abdominal pain. Young female, early 20s with suprapubic lower abdominal pain for days. She says the pain was constant. Try to ask her many questions including sexual history. She denies dyspareunia, which is painful intercourse. On exam she is tender. Labs, ultrasound neg. Relief with pain meds. But REX mean her belly, and she's still quote tender. Not a patient you'll just discharge home. So I get a cord scan. Negative. I walk in the room and talk to her and explain the last thing I can think of is to do a pelvic exam. I insert the speculum and see something blue in her vaginal canal. I pull out a condom and a wave of meloda wafts over me. The patient says, oh, I haven't had sex for a month. I've retrieved many condoms pressed up against cervixes. I usually say please tell your partner to wear smaller condoms, but I refrained from telling her that. The other case was a Bartholin's gland cyst. This is a tiny cyst women develop, usually just inferior and to the side of the vagina. The patient tells me she noticed the pain for a little while. I examine the patient. My exam is suspicious for the cyst as she has a slightly red bulge exactly where it should be. I explain the procedure as it is pretty routine, as I have seen an unknowable amount of these abscesses. The nurse is chaperoning me, and I make my incision after she was all prepped. I don't think I've ever seen so much pus in my entire life. It literally took 20 to 30 minutes to express all the fluid. I wound up sticking my hand in her vagina, pressing against the ipsilateral wall, and pulling my taut fingers and just wouldn't stop coming. If I was to guess, it was maybe 200, 300 ccs of pus. Or a water bottle. Truly the iceberg of abscesses. The patient handled it well. Those two are the stories that stand out. Edited. Have to haven't. Bartholin's gland cysts are no joke. When I was younger and uninsured, I had to deal with mine on my own in my bathroom. Luckily, I worked as a vet tech and had access to sterile supplies and knew how to clean an abscess, but it was still insane. Goddamn the American health insurance system. I suggest everyone reads What's Up Down There by Dr. Liza Renkin. In a section of her book she writes about the worst things she's seen. One is maggots. One is money. The usuals. But the best is a potato growing vines out of a woman's vagina. Now we are getting somewhere. A woman showed up in the and told her she had vines growing out to her jojo. Sister. Vines were, indeed, hanging out of her. Apparently potatoes make good birth control. Makes sense. I wouldn't stick my dick inside of a vagina that had a growing potato inside. Not a gynecologist, but my mom said she saw a woman come into the after the woman's boyfriend stuck a gun inside of her vagina and shot her. I didn't ask for more detail. Not a gyno. But I had a very tiny birth defect that went unnoticed until I tried tampons. The opening to my vagina didn't form properly, so there was a piece of flesh going through the middle. essentially creating two holes. One time as a teenager I couldn't retrieve a tampon. Basically I put the tampon through the bigger hole and was trying to pull it out the smaller one and it would not budge, also very painful. Lucky for me this also happened at church. My mom thought I was just an idiot who got a tampon stuck in her. Later went to the OBGYN and they noticed it. Remove it and no problems now. Vaginal septum. They are normal and can vary in degree of septumness. Well, after reading some of these stories I will never again be embarrassed about not having perfectly shaved legs and bikini area when I go to the gynecologist. Here's a perspective thing that ruins sex for me rather than something I've actually seen. My mother, a gynecologist trying to convince me to go into gynecology, starts telling me how you'll start seeing every vagina as a book telling you a story. And ever since I couldn't look at a vagina the same way again. Take a look. It's like a book. Reading Rainbow. Bleeding Rainbow. Not a gyno, but saw this observing an nerd during my EMT training. Elderly woman came in after a fall. She had cancer of the vulva that had grown so large and infiltrated the area that her pelvis looked like it had a soccer ball 2/3 embedded in it. She fell because the tumor was pressing on the nerves for her left leg. It was also restricting blood flow as the left leg was much cooler to touch than the right. Not a gyno, but I see a lot of train wreck crotches. So 1. Vaginal cancer post-surgery. Complete removal of vagina and cervix. I was a student and am not familiar with all of the procedures done. Left a giant, gaping, dripping hole where everything was. Poor lady was devastated and begging her husband to leave her because she said, "You can never love me after this." He was by her bed the whole time, holding her hand, with a constant stream of love and reassurance. He adored her. 2. 500-pound woman, paraplegic. Massive pressure ulcers/necrotizing fasciitis that destroyed her entire genital and buttock area. Doctors kept telling us to get a urine sample, and we kept telling them to give it a shot. She had no bladder anymore. It took 6 of us to turn her and pack the wound, which consisted of shoving handfuls of gauze in the crater and hoping she wouldn't speep herself during the procedure. Vagina was long gone. We think the rectum had multiple erosions because feces would leak from multiple areas in the wound. Died quickly. Nothing we could do. Oh my god. Did she not have anyone to help take care of her, and that's how her condition got so bad? That's such a terrible way to go. Not a gyno, but do have to do those exams. One time I had to extract a tampon that had been there at least a month, all the while she'd been having sex. The smell was so bad it lingered for hours in the clinic and everyone in the room was gagging. How the hell did she not realize? Could she not smell it? Jesus. I feel like I can smell it just reading that story. For some reason people get used to it quickly enough they don't notice. I tried my hand at online dating once. We met up at a German restaurant, so I thought the odd smell was the sauerkraut at the table next to us. For the next date she invited me over to her place and found out that it was something else causing a bad smell. When I asked her about it, she seemed legitimately confused. He stopped the story right at the point where this could go very wrong. When you realize she has sore crotch, that's always where the story ends. Undefined. Ginny nurse here. Surprisingly, I don't see a lot of gross things. Women tend to be sensible with their vaginas. And vaginas are very tough. They can take a lot of abuse and still be normal. The worst thing I've seen was a lady who went in for a hysterectomy, but the surgeon accidentally nicked her bowel on the way in. They had to abandon the surgery and wait for the bowel to heal. But it didn't. Instead it formed a fistula. The part of her bowel that was nicked attached itself to the surgical wound on her stomach. So poop started pouring out a hole in her belly. It is very difficult to heal a wound that has poo coming out of it. She was in hospital for 9 months with a myriad of infections, wound breakdown, very complicated wound dressings that took hours to do. Everything you would expect from a giant wound full of poo. At its biggest, I could fit both my fists into her poopy wound. She ended up having a permanent colostomy, a poo bag, and last I heard, she still had her peeping uterus intact. Holy speep. I hope she didn't have to pay for any of that, i.e. Medmal insurance covered it. My mom has a story about one patient that I think is her grossest hospital story. This woman in her 50s was morbidly obese at around 500 lbs. She came to the hospital saying her husband had noticed an odor, but the whole floor could smell her. I don't remember the how part, but essentially her vagina was full of necrosis, and she had to be fully debrided. She ended up dying anyway. Best part was husband noticed the odor during sex. Funny as gangrene is no joke. Do yourself a favor and don't Google image pictures of it. You don't tell me what to do. Undefined. Why did I Google that? Kind of late, so this will probably get buried, but medical student here. Will be a doctor within the next few weeks. Though not an ob/gyn. In my ob/gyn rotation I had a case that I thought was the worst case of bacterial vaginosis I had ever encountered, based purely on the smell when conducting the pelvic exam. I didn't see an abnormal amount of discharge during the speculum exam, and I noticed the smell got stronger as I moved away from the patient when completing the exam. It turned out the smell came from the patient's feet, which were on the stirrups and in extremely close proximity to my face while conducting the exam. No. Important info. Was she wearing socks or bare feet? Not sure which is worse at this point. Why am I even deciding to read this? I hate myself. One of us. Med student here. During a gynecology rotation I scrubbed to do an open hysterectomy for what we thought would be a small contained ovarian cancer. Turned out the belly was full of mets, and we spent 13 hours debulking during what was scheduled to be a 3-hour operation. We needed general surgery and vascular in the room 4 parts, and replaced half of the patient's blood volume. Patient did not do well. Had a long rocky post-surgical course. Eventually went home CMO with her family. It was a very emotionally devastating case for everyone involved. The patient and her family were wonderful people, and it was a privilege to be involved in their care. Not a gynecologist, but my mom had a pretty severe case of endometriosis and her uterus had prolapsed as she didn't let herself recover after she gave birth to me. When I was 8, I walked into her undressing, and she was bent over without underwear. What was a scarring event was much more confusing, as I thought she had carrots coming out of her vagina. But it was her peeping uterus. How she could tolerate that, I will never know. Like she had to wipe and everything. I assume she was just moving it out of the goddamn way. Ugh. She had a hysterectomy, but it was peeped. The doctors described her insides were covered in adhesive, and she almost lost her bladder. Her hysterectomy left her abdomen covered in an awful horizontal scar that's misshapen, and she had to pee out of a bag for months. To this day, she cannot go to the bathroom normally. I have endometriosis and I sure as peep will keep on top of that speep, because watching her go through that was a nightmare. Not a gynecologist, but someone I know has recently had a hysterectomy and the cervix removed. Their internal stitching split open due to rushing certain activities and their small intestines prolapsed out. Let's just say I'll never eat mince again. They told me in graphic detail, before they went for emergency surgery, that they could feel the intestines pulsing against their leg. How do I delete someone else's comment? How do I delete the mental image? Maybe not the worst. And I'm not a gyno, but my mother does pap smears, as nurses in Australia can do them. She was booked in for a smear, and when the patient came in, she was quite an overweight lady, and my mother could not to her cervix. So they called in another nurse, mum reassuring her the whole time this was quite normal, so the nurse could hold back some of the woman's flesh. Still couldn't quite access the cervix. So they call in the doctor. He also helps with holding back the woman's flesh, who was embarrassed and practically in tears, and they successfully do the smear. Now in Australia, a pap smear is usually free if you go to a bulk billing clinic, as this clinic was. However, the doctor was an asshole. He no longer works there. actually, and decided as he'd had to assist for 2 minutes on a pap smear, it no longer counted as a routine smear and charged the woman a private consult fee. So, a free pap smear that ended up with 3 people having to look at this poor woman's genitals and push and pull her body around. The patient was holding it together until she got to the front desk, and the medical receptionist, who didn't know what had happened, asked her for the $50, and she burst into tears. They ended up waiving the fee, but mum felt so horrible for the patient. That was one of the worst things she ever saw in her capacity as a sexual health nurse. Also, I don't know why the woman was so overweight, but she shouldn't be judged for that, considering she was still trying to take care of herself by going to get a smear. I asked this question to a good friend of mine, who is a gyno, and she answered a Doritos bag. Patient was morbidly obese, and my friend found the bag while moving her skin folds out of the way to give her the exam. Work in a busy emergency department. The amount of tampons, diva cups, sex toys and drug paraphernalia that we need to remove is disturbing. I'm never going to forget the smell. It is so awful. Lingers for hours, even though we remove the trash immediately. It is just that bad. One case, a patient arrived in the trauma bay via police escort to have a check before going back to jail. She could not be checked by us nurses before getting a scan done to check what she shoved up her coin purse. Her words. Upon the images coming back from radiology, we found she had shoved over 7 uncapped hypodermic needles up there, some baggies and a busted crack pipe. When she got to the jail, a jail intake nurse got stabbed with one said needle. That's how she made it over to our place. She was admitted and sedated so all the items could be safely removed without endangering staff. My friend was so scared of the gynecologist in high school. She went for her first pap smear and was so clenched and tense that she put the doctor in a headlock with her legs. It took her a while to calm down and relax her legs enough to get the gynecologist enough room to sit back up. It was awkward. She laughs at it now, but she's still very timid about down there. She doesn't even like to use tampons. Has she ever been sexually abused? That could be more than just an headlock reaction. Not that I know of. She was a very shy and sweet girl, raised in a very conservative, southern, proper home. She's a friend, but we aren't that close. I think it's just taboo for her, paired with anxiety. She cried when she got the flu shot as well. Hopefully it was just being raised by very caring, over-sheltering parents. Some kids have childhoods where the parents might block out the PG-13 and up stuff to protect their kids. Not an actual gynecologist, but I've been doing nursing for a number of years. I once had a doc come out of a pelvic exam and say 2 of the worst words you can use together. Vaginal maggots. There was no serious tag, yet I found only one "your mom" comment, and it had been downvoted 22 times. I'm proud of you today, Reddit.
Thank you so much for watching Reddit with Shelter, Reddit with Shelter. If you like this video,